Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss about STEP-HFpEF trial that examined the effects of semaglutide on patients with heart failure and preserved ejection fraction, HFpEF. Semaglutide is a drug that is being used to treat type 2 diabetes and obesity. It is sold under the brand names Ozempic, Wegovy, and Rybelsus. Semaglutide was developed by Novo Nordisk in 2012. Semaglutide works by mimicking the effects of a hormone called glucagon-like peptide 1, GLP-1. GLP-1 is released by the gut after eating and helps to regulate blood sugar levels. Semaglutide also helps to suppress appetite and promote weight loss. In clinical trials, semaglutide has been shown to be effective in reducing blood sugar levels and helping people lose weight. It is generally well tolerated, but some side effects can occur, such as nausea, vomiting, and diarrhea. Semaglutide is a long-acting medication that is injected once a week. It is generally well tolerated, but some people may experience side effects such as nausea, vomiting, and diarrhea. In a new trial published in Nature Medicine in the 28th of August 2023, semaglutide seems promise in patients with congestive heart failure with preserved ejection fraction also. In the STEP-HFpEF trial, semaglutide was effective in improving symptoms, physical limitations, exercise function, and body weight in patients with obesity phenotype of heart failure and preserved ejection fraction. This pre-specified analysis looked at the effects of semaglutide on the dual primary endpoints, change in Kansas City Cardiomyopathy Questionnaire-Clinical summary score and body weight, and confirmatory secondary endpoints, change in 6-minute walk distance, hierarchical composite, death, heart failure events, change in Kansas City Cardiomyopathy Questionnaire-Clinical summary score, KCCQ-CSS, and 6-minute walk distance, 6MWD. And change in C-reactive protein, CRP, across obesity classes 1 to 3, BMIs, 30 to 35, 35 to 40 and more than 40, and according to body weight reduction with semaglutide after 52 weeks. Semaglutide consistently improved all outcomes across obesity categories. In semaglutide-treated patients, improvements in KCCQ-CSS, 6MWD, and CRP were greater with larger body weight reduction. For example, there was a 6.4-point improvement in KCCQ-CSS and 6MWD for each 10% body weight reduction. In conclusion, semaglutide improved symptoms, physical limitations, exercise function, and reduced inflammation and body weight across obesity categories in patients with obesity phenotype of HFpEF. The magnitude of benefit was directly related to the extent of weight loss. These data support semaglutide-mediated weight loss as a key treatment strategy in patients with obesity phenotype of HFpEF.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.